Peppermint oil is commonly used to help with stomach and intestinal issues, like upset stomach, cramps, and irritable bowel syndrome, IBS. It's important to note that Ibgard should not be given to children under 8 years old. It's also important to be aware that some herbal or dietary supplement products may contain harmful impurities or additives. It's always a good idea to check with your pharmacist to learn more about the specific brand you're using. It's also worth noting that the FDA has not reviewed Ibgard for safety or effectiveness. As always, it's a good idea to consult with your doctor or pharmacist for more details about using this product. When it comes to using Ibgard, the recommended daily dosage and the best time to take it can vary depending on individual needs. It's always best to follow the instructions on the product packaging or consult with a healthcare professional for personalized guidance. When taking Ibgard, make sure to follow the directions on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for guidance. If you're using the capsule form, remember to swallow the capsules whole and do not crush or chew them. This can increase the risk of side effects. If you have trouble swallowing the capsules, some brands allow you to open the capsule and sprinkle the contents onto a spoonful of cool, soft applesauce. It's important to swallow all of the mixture right away without chewing. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help immediately. If you experience nausea, vomiting, or heartburn, it's important to let your doctor or pharmacist know. Serious side effects like headache, flushing, mouth irritation/sores, or severe stomach/abdominal pain should be reported to your doctor right away. While rare, a serious allergic reaction could occur, so seek medical help immediately if you notice symptoms like rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. As for the best time to take Ibgard, it's recommended to follow the dosage instructions provided by your doctor or on the product packaging. Always consult with your healthcare provider for personalized advice on using this medication. Before using Ibgard, make sure to inform your doctor or pharmacist if you are allergic to peppermint oil or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues. If you have heartburn, stomach or intestinal ulcers, liver disease, or gallbladder disease, it's important to consult your doctor or pharmacist before using Ibgard. The liquid form of Ibgard may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, or liver disease, be cautious and ask your doctor or pharmacist about using this product safely. If you are planning to have surgery, it's important to inform your doctor and dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Ibgard is not recommended for use during pregnancy, so it's important to consult your doctor for more details. It is unknown whether Ibgard passes into breast milk, so it's important to consult your doctor before using this product if you are breastfeeding. When taking Ibgard, it's important to be aware of the potential for drug interactions. This means that Ibgard may affect how other medications work, or increase the risk of serious side effects when taken together. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Before making any changes to your medication regimen, always consult with your doctor for their approval. If you or someone else has taken too much Ibgard and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for further guidance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. It's important to keep all your medical and lab appointments while taking Ibgard. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of Ibgard, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Ibgard, always refer to the storage information printed on the package. If you have any questions about storage, be sure to ask your pharmacist. It's important to keep all medications and herbal products out of reach of children and pets. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.